couple of weeks ago, we talked about atrial fibrillation, which is an irregular heartbeat that causes the heart to not pump blood properly to the rest of the body. Dr. Ralph Paioni performs what's called the mini-maze procedure here in Lubbock.
Doing the mini-maze procedure about 5 years ago at the Lubbock Heart Hospital, where there was an initial study of about 100 patients. That was done by Dr. Fowler and Dr. Rizzo Patrone. At that time, I participated with Dr. Fowler in the surgical operation itself. It's interesting, intriguing, and had very good results, and that's why I've continued to perform the procedure.
At this time, Dr. Paioni performs this procedure once a week.
The mini-maze procedure, I think, is an excellent procedure for someone who has been treated with medications but continues to have atrial fibrillation.
The mini-maze procedure is a newer procedure that has a tool that's about 1.5 inches wide, or something along the size of pliers. That goes into one of 2 insertions that are made in the chest cavity, and they go in between the ribs. There's 2 of them right here. The tool goes into one of those and actually ablates or burns and makes scar tissue in the area where the irregular heartbeat is happening to correct it and make that actually stop and for the heart to beat regularly. A large part of the U.S. suffers from AFib, but not everyone is a candidate for the mini-maze procedure.
Generally speaking, they have to be fit enough to undergo a major surgery. Beyond that, there's other reasons that other concurrent medical problems which may prohibit some patients from having the procedure.
Dr. Paioni says the effectiveness of the procedure depends on the type of AFib the patient has.
Percentage-wise, the success rate is anywhere from 60% to 90%.
The surgery takes about 2 hours, and then the patient will spend 3 to 4 days in the hospital.
The ideal outcome would be normal heart rhythm and no medications for atrial fibrillation and no blood thinners.